AFM stands for Acute Flaccid Myelitis. It's a rare but serious condition that affects the nervous system. People with AFM often suffer from sudden onset paralysis. Some have compared the symptoms to polio, and while it's not a new condition, the number of reported cases has recently increased. In the US, the CDC confirmed 386 cases since August 2014. Most of them have been young children. Canada doesn't track the illness the same way. It only monitors cases from a broader category that includes AFM. But doctors at hospitals, including those in Toronto and Montreal, say they've seen more patients with symptoms often associated with AFM. Just what it is and why more people are getting it now is still a mystery. What we do know is that it affects the area of the spinal cord called gray matter. It weakens muscles and reflexes. Often the symptoms can show up after a cold or other illness. Parents should take notice if their child complains of tired legs or if they have trouble getting up from a chair or going upstairs. Other warning signs include droopy eyelids or an asymmetric smile. In the most severe cases, children may have difficulty swallowing or breathing. As for what causes it, experts still aren't sure. In the US, cases didn't cluster around a specific region, and tests haven't shown any one pathogen is to blame. Most cases occur in the late summer and early fall. Researchers are investigating possible causes, including different viruses, like the one behind the common cold and enteroviruses. The CDC is also looking into environmental toxins as a possible cause. So what's the treatment? Well, the long-term prognosis for people with AFM is still unknown. There's no specific vaccine. Doctors have been treating patients on a case-by-case basis, mostly by dealing with their symptoms. Some patients recover quickly, but others need ongoing care. It all sounds scary, but keep in mind the condition is very rare. Every year in Canada, complications from just the common flu lead to thousands of hospitalizations and deaths. So far, no deaths linked to AFM have been reported in Canada, and only a handful of cases have been confirmed here. So what can you do to protect yourself and your family? Well, until researchers find out more about the cause and effective treatments, your best bet is to use some common sense. Wash your hands and make sure that your kids are doing the same. Keep your vaccinations up to date and use insect repellent when traveling or during the summer months.